In the early 1920s, residents of Scottsbluff and Gering decided it was time for their growing communities to have the kind of high-quality healthcare that was only available in larger cities. They donated their time and money and encouraged other communities to join them in building a modern hospital, and their dream took off. What was once West Nebraska Methodist Episcopal Hospital is now Regional West Medical Center, and it continues to provide excellent care and specialized services for the very same reason it was built in 1924. So area residents get the care they need close to home. It all began with a $40,000 investment in an unfinished hotel at 18th and Broadway in Scottsbluff. Local business leaders pooled their money with funds raised by the Scottsbluff Chamber of Commerce to buy the empty building, which they thought would make a fine hospital. On April 15, 1924, West Nebraska Methodist Episcopal Hospital opened. Only 2 of the 6 floors were completed. Later that year, the hospital opened a nurses' training school. By 1927, nearly 4,000 patients had been admitted and 2,200 surgeries had been performed. As the demand for hospital care grew, area residents raised money to finish the 3rd floor, and then the 4th. The hospital thrived despite financial hardships during the Great Depression of the 1930s and staff and supply shortages during World War II. After the war, the region's first specialists joined the medical staff. With the spread of polio in the late 1940s, the hospital hired a physical therapist and developed a small polio ward. Soon, patients were coming to the Methodist Hospital from as far away as Grand Island, and the polio ward expanded. In 1954, the hospital's name changed to West Nebraska General Hospital. By 1960, plans were underway to build a new hospital. Again, the community pitched in with volunteer support and fundraising, and in 1965, construction began. On May 6, 1967, the new West Nebraska General Hospital opened. The 117-bed facility included West Nebraska General Hospital School of Nursing and a nurses' dormitory. A period of tremendous growth followed as an influx of family practice physicians and medical specialists joined the staff. Specialized services were added, including home health care, dialysis, neurosurgery, intensive care, and more. The campus expanded as well. In 1977, St. Mary Hospital was purchased and merged with the General Hospital. In 1979, West Nebraska General Hospital's Southwest Edition was completed, adding the region's first neonatal intensive care and coronary care units, outpatient surgery, 24-hour emergency department, and more. Within another 6 years, the hospital celebrated the opening of MedCenter 2000. It included the addition of the West Patient Tower, expansion of the radiology and surgery departments, and a new kitchen and cafeteria. With the opening of the Psychiatric Center at St. Mary Hospital in 1984, the hospital dramatically expanded its role in regional patient care. In 1988, the hospital's name changed to reflect its status as a regional referral center. It became Regional West Medical Center. The campus continued to expand with the addition of the Village at Regional West and construction of new medical office buildings. In 1994, Regional West was verified as a Level 2 trauma center by the American College of Surgeons, launching AirLink as the region's only air ambulance service and leading to construction of an all-new emergency department and main entrance. As Western Nebraska's only trauma center, Regional West developed a continuum of care, so patients could receive exceptional care from the time they called for emergency services through emergency and trauma care, hospitalization, rehabilitation, and home care. In addition to offering the region's only comprehensive behavioral health center, the beginning of the 21st century brought the opening of the region's only cardiac catheterization lab, acute rehabilitation unit, and interventional radiology suite. Rapid advances in technology, changes in healthcare legislation and reimbursement, and other challenges led to integrating local clinics with the hospital. In 2008, more than a dozen local physicians' offices became part of Regional West Physicians Clinic. Since then, clinics have expanded to other regional communities, and Regional West physicians and providers travel throughout the Panhandle year-round to deliver specialized care at outreach clinics for the benefit and convenience of regional residents. To further provide quality care close to home, Regional West affiliated with the University of Colorado Cancer Center in 2018. This partnership allowed regional patients to receive cancer treatment at Regional West while providing greater access to cancer specialists when needed. The opening of the new cardiac catheterization unit and addition of 3D tomography, both of which were made possible by Regional West Foundation, demonstrated the medical center's ongoing commitment to enhancing patient care. In 2020, a new 12-bed critical care unit opened on the hospital's second floor. As COVID-19 went from being a new threat in the United States to being very real in western Nebraska, Regional West's leadership and employees prepared for the eventuality by holding planning meetings in December of 2019, well before the county's first confirmed case on March 29, 2020. In the early days of COVID-19, the community pitched in to help, making cloth masks, donating food and gift cards for employees, and creating a night called Light Up Regional West on May 2, 2020, when local first responders drove by the facility with their flashing lights on in a show of support. To help make sure patients received the care they needed during the pandemic and beyond, Regional West expanded virtual healthcare options in 2020. All care providers, employees, patients, and visitors were required to wear masks until March 2023. On March 20, 2023, Regional West lifted the 3-year visitation policy and welcomed visitors of all ages back to the medical center and physician's clinic. During the pandemic, patients were limited to the number of visitors they could have, as well as the ages of visitors. Regional West entered a new era of surgical innovation in 2020 when the Da Vinci robotic-assisted surgical system was added. In 2022, fundraising began for the new Varian Edge Linear Accelerator for the Cancer Treatment Center at Regional West. Regional West Emergency Medical Services, EMS, began providing services in Scottsbluff County in 2023, including the Scottsbluff County 911 service. This marked the first time in the history of Regional West that all emergency services, ground, rotor, fixed-wing aircraft, and the emergency department were under one executive director. As we celebrate our 100th year of offering excellent healthcare, it's clear that our mission is still very much the same as it was in 1924. Even though we're now a regional referral center, here in western Nebraska, neighbors still care for neighbors. Now, as then, we are committed to advancing the health and wellness of the individuals and communities we are honored to serve.